Hello everyone, and welcome to my symposium. Today, I'll be discussing an article titled Knowledge and Communication Difficulties for Patients with Chronic Heart Failure, a Qualitative Study. This article was written by A.E. Rogers, J.M. Addington Hall, A.J. Aberry, A.S.M. McCoy, C. Bulpitt, A.J.S. Coates, and J.S.R. Gibbs. It was published in the British Journal of Medicine in the Department of Palliative Care. The main topic that this article focuses on is healthcare communication in patients with chronic illnesses, and in this case, the chronic illness being congestive heart failure. Now, let's focus on the study. The study conducted chose 27 patients. They were classified as having New York Heart Association classification stage 2, 3, or 4 heart failure, 4 being the worst. The average ejection fraction was 33.1%. Normal ejection fraction is roughly 50 to 60%. Treatment regimens included diet and lifestyle modifications and complex medication regimens. The average hospitalization in the last 2 years was 1.7. There were 7 patients who had class 2 heart failure, 12 had class 3 heart failure, and 8 had class 4 heart failure. The interviews were tape recorded, and the 2 main factors that were considered were the patient's understanding of their disease process, including prognosis, and effective communication with their physicians. Patients were unsure why they developed heart failure. Some felt they developed it simply because they were growing older. Some questioned the course of the heart failure. Is this terminal? Some knew it was terminal, but failed to acknowledge such. Some patients felt doctors were not discussing death with them and did not want to discuss death with them. Some barriers. Patients felt doctors did not want to reveal information or provide too much information to them. Alternate drug regimens. Patients felt like they couldn't ask the doctor if there was any other option for them for a different medication. Say they're having a side effect to one medication, they didn't feel comfortable asking their doctor for a different one because they felt the doctor knew best. Confusion and short-term memory loss. This was one of the effects of congestive heart failure, and it was limiting communication between patients and their physician. Now, I'll critique this study. One major strength I felt this study had was it was able to focus on the major topic of healthcare communication in patients with chronic illnesses, and this being congestive heart failure. I think it did a very good job doing so. One major weakness which I feel this study could have is the small sample size. However, it was a qualitative study, not a quantitative study. Now some questions for the audience. Number 1, do you feel the sample size was enough to obtain a good understanding of communication between patients and doctors, given the underlying qualitative nature of the study? Number 2, how do you feel we may better educate patients who may have an inadequate understanding and knowledge of their disease process? Number 3, do you feel the depression patients feel and experience with congestive heart failure is because of their poor communication with their physicians? If not, what else could play a role in this? Number 4, who do you feel would be best able to appropriately discuss the long-term effects of heart failure with the patient? Is it the physician who sees the patient in the office, or could it be a heart failure nurse who sees the patient on a weekly basis? To conclude, I think this was an excellent study. However, it only slightly peels away a small layer of a big problem, which is healthcare communication in patients with chronic illnesses, as we're only dealing with one chronic illness here, which is congestive heart failure. There are many, many other chronic illnesses patients face. I thank you all for watching, and I look forward to speaking to you in response to the questions. Thanks for watching.